So, with your permission, we would like to start our session. So, good afternoon, ladies and gentlemen. A very warm welcome again. In this session, we are going to discuss on One Health approach. One Health is an integrated, unified approach to balance and optimize the health of people, animal, and the environment. It is particularly important to prevent, predict, detect, and respond to global health threat. So now I would like to call our chair. Our chair has served us as Chief Veterinary Officer and OIE Delegate for Japan. He has 30 years of experience in Ministry of Agriculture. Currently, he is the WOAH Regional Representative for Asia and the Pacific. A big round of applause for Dr. Hirofumi. Big round of applause for Dr. Hirofumi, our chair for today. So, hi, sir. Our next speaker has a doctorate degree in veterinary medicine from China Agricultural University. Currently, she's working in the Joint Center of Zoonotic Diseases. Please put your hands together for Dr. Song. Our next speaker is a veterinary epidemiologist and the head of the Emergency Prevention System for Animal Health. She's also the co-lead of FAQ's One Health program. A big round of applause for Dr. Dhingra. And our next speaker is a professor and has been working in the dairy industry for a very long time. He's also the chair of the International Dairy Federation Standing Committee on Animal Health and Welfare. Let's call Dr. David Kelton. A big round of applause for Dr. David Kelton, guys. Our next speaker is a principal scientist and veterinary microbiologist, currently officiating in animal husbandry. He has a vast research experience on zoonotic diseases. A big round of applause for Dr. Malik. And our next, last but not the least speaker is the veterinary Masters in Animal Science and Supervision of Milk Quality, Dr. Celilia. A big round of applause for Dr. Celilia. So now I would like to hand over the mic to our Honorable Minister. Please, sir, I would like you to share some words with our audience.
वर्ल्ड डेयरी समिट में आज के एनिमल डिसीज मैनेजमेंट वन हेल्थ अप्रोच पर सेशन में उपस्थित सभी पार्टिसिपेंट्स को मैं स्वागत करता हूँ। वन हेल्थ इंडिया के लिए बहुत नया विषय नहीं है, लेकिन दुनिया के लिए एक न्यू डिबेट का विषय के रूप में पिछले 15-20 साल से आए हैं। हमारे यहाँ सह अस्तित्व की सिस्टम ही जीवन शैली की ऐसी थी कि परस्पर एनिमल्स, humans and environment, ये तीनों सिस्टमेटिकली एक और दूसरे के साथ जुड़े हुए थे। बेसिकली वी आर ऑल्सो वन टाइप ऑफ एनिमल। हम भी एक एनिमल तो है ही, और उसका बेस्ट एग्जाम्पल है, आपको कोई भी ग्रीनरी, ग्रीन, जंगल, फॉरेस्ट सभी को अच्छा लगेगा। Forest, why you are attracted to forest? Reason is it that you belong from forest. आप forest से ही आए हैं. So animal, we are also one type of animal, but three type of animals. One is forest animal. एक फॉरेस्ट एनिमल है, दूसरा डोमेस्टिक एनिमल एंड तीसरा ह्यूमन. ये तीन और उसके साथ एनवायरमेंट जुड़ जाता है, एनवायरमेंट इकोसिस्टम जुड़ जाती है, और उसका अध्ययन करने के लिए एक जो नया शास्त्र के रूप में हमने डेवलप किया है उसको वन हेल्थ अप्रोच के रूप में हम लोग डिबेट करते हैं. और ये स्वाभाविक है, एनिमल से कोई डिसीज ह्यूमन में आना, ह्यूमन में से कोई डिसीज एनिमल में जाना. कोविड क्राइसिस में हमने देखा, और स्वीडन की एक स्टडी दिखाई दे रही थी कि वहाँ के एक मॉन्स ऐसा कोई एनिमल था, तो उसमें उसको, वो डोमेस्टिक पालतू था, किसी ने उसको पेट के रूप में रखा था, तो उसको भी कोविड का सिम्टम दिखाई दिया, और स्टडी में निकला कि उसको भी कोविड है. तो ह्यूमन से ट्रांसफर होके एनिमल में गया. एनिमल के डिसीज ट्रांसफर होके ह्यूमन में आते हैं. माई सेल्फ इज वेटनरियन ऑल्सो. तो मैं जब प्रैक्टिस करता था उस वक्त मुझे भी, मैं डिस्टोकिया का केस कवर कर रहा था, तो मुझे भी एक बार ब्रुसेलोसिस हो गया था. तो एनिमल डिसीज है, वो ट्रांसफर टू ह्यूमन. एनिमल डिसीज ह्यूमन में ट्रांसफर होते हैं. ऐसे नंबर ऑफ डिसीज है जो एनिमल से, रेबीज एनिमल से ह्यूमन में ट्रांसफर होते हैं, एंथ्रैक्स एनिमल से ह्यूमन में ट्रांसफर होते हैं. ये सब डिसीज कोई ह्यूमन से एनिमल्स में, एनिमल्स से ह्यूमन्स में डिसीज ट्रांसफर होना स्वाभाविक है, लेकिन उसका कॉम्प्रिहेंसिव स्टडी होना ये भी आवश्यक है, क्योंकि उसकी बहुत बड़ी इफेक्ट होती है. ह्यूमन लाइफ पर भी उसकी इफेक्ट होती है, एनिमल के पर भी उसकी इफेक्ट होती है, डेयरी साइंस पर उसके, सबसे एनिमल हेल्थ पर उसकी ज़्यादा इफेक्ट होती है. क्योंकि हम उसको कॉमर्शियल के रूप में, एनिमल्स हम क्यों रखते हैं? एनिमल्स हम इसलिए रखते हैं, वो मिल्क देता है, डंग्स देता है, उसका यूज़ हम एग्रीकल्चर में करते हैं, मिल्क का यूज़ हम हमारे फूड में करते हैं. तो ऐसी स्थिति में वो कॉमर्शियल वायबल नहीं होगा तो हम उसको रखेंगे नहीं. उसको कॉमर्शियल वायबल रहे इसलिए उसको डिसीज ना हो, डिसीज कंट्रोल हो, डिसीज का स्टडी हो बहुत आवश्यक होता है. और ये डिसीज को कंट्रोल करने के लिए, डिसीज को समझने के लिए सर्वेलेंस आवश्यक होता है, स्टडी आवश्यक होती है. और ट्रांसफर होके जब एनिमल में, एनिमल से ट्रांसफर होके ह्यूमन में आ जाता है, एनिमल्स टू एनिमल्स, एनिमल्स टू ह्यूमन, उसकी एक इफेक्ट एनवायरनमेंट पर भी होती है, एक इकोसिस्टम पर उसकी इफेक्ट होती है. उसका डिटेल स्टडी हो, ये बहुत आवश्यक होता है. और इसलिए प्रधानमंत्री जी ने एक अच्छा स्लोगन दिया, वन अर्थ वन हेल्थ. सारी दुनिया में एक टाइप की स्टडी कैसे हो, एक टाइप का अप्रोच से हम वन हेल्थ को कैसे देखें. हमारा एनिमल सेक्टर में, ह्यूमन, एनिमल सभी में जब कोई डिसीज होता है तो उसका सर्वेलेंस होना बहुत आवश्यक है. उसका सर्वेलेंस हो, सर्वेलेंस तब कर पाएंगे जब आपके पास इंफॉर्मेशन हो. इंफॉर्मेशन टू सर्वेलेंस, सर्वेलेंस टू डेटा. सर्वेलेंस से डेटा कलेक्ट होगा, आपके पास डेटा हो, और डेटा को मेटा डेटा में कन्वर्ट करना हो, और मेटा डेटा को कन्वर्ट करके इंटीग्रेट करना हो. ये 3-4 चीजें एक साथ में होना बहुत आवश्यक है. और हम कैसे करें? जो हम नहीं कर पाएंगे तो वन हेल्थ नहीं हो पाएगा. वन हेल्थ अप्रोच से हमें काम करना है, तो एक सेक्टर में काम करना बहुत आवश्यक है. और इसलिए भारत सरकार ने डीबीटी के माध्यम से एक हेल्थ कंसोर्टियम बनाया हुआ है. हेल्थ कंसोर्टियम के माध्यम से ह्यूमन इंस्टीट्यूट, रिसर्च इंस्टीट्यूट उसके साथ जुड़ी हुई है, एनिमल क्लिनिक और हॉस्पिटल उसके साथ जुड़ी हुई है. उसका एक कंसोर्टियम के माध्यम से समय समय पर उसका डेटा, डिसीज का डेटा कलेक्ट करना, डेटा को सिनर्जाइज करना, ये काम आज के दिन में ऑलरेडी चालू हो चुका है। आईसीएमआर के माध्यम से हमने नेशनल इंस्टीट्यूट ऑफ वन हेल्थ का भी प्रारंभ कर दिया है, ताकि आईसीएमआर उसके पर काम चालू करे। देश के कई पार्ट में भी आज वन हेल्थ अप्रोच के साथ यूनिवर्सिटी में एजुकेशन के सिलेबस के रूप में भी इम्प्लीमेंटेशन होना चालू हुआ है। केरला में केरला वेटनरी साइंस यूनिवर्सिटी में डिप्लोमा पोस्ट ग्रेजुएट कोर्स के रूप में वन हेल्थ को लिया गया है। लुधियाना यूनिवर्सिटी ने भी वन हेल्थ पर काम करना चालू कर दिया है, ताकि वन हेल्थ अप्रोच के साथ हम लॉन्ग टाइम काम करके एक ऐसा डेटाबेस क्रिएट करें। ये डेटाबेस केवल एक स्टडी के रूप में आपके सामने एक वन टाइम आएंगे, लेकिन ये डेटाबेस आपको भविष्य में कई डिसीज को एलिमिनेशन करने के लिए भी उसका उपयोग है। और इसलिए ये सब काम करने के लिए केवल एक कंट्री करे वो भी आवश्यक नहीं है, केवल एक कंट्री ने, एक यूनिवर्सिटी ने कर लिया जी नहीं, क्योंकि समय बदल गया है। अभी ट्रांसपोर्टेशन, पहले तो कभी किसी को दूसरी कंट्री में जाने के लिए भी समय लगता था, ह्यूमन को भी, व्यक्ति को भी एक देश से दूसरे देश में जाने के लिए शिप में जाना पड़ता था। बॉर्डरिंग कंट्री हो तो भी जाने के लिए बहुत रिस्ट्रिक्शन हुआ करता था। आज ग्लोबलाइजेशन के समय में हमारा ट्रांसपोर्टेशन ग्लोबली होता है, नहीं केवल हमारा, लेकिन एनिमल का ट्रांसपोर्टेशन भी होता है, एनिमल का माइग्रेशन भी होता है, वाइल्ड लाइफ का माइग्रेशन भी होता है। ऐसी स्थिति में माइग्रेशन, आप मसाई मारा के फॉरेस्ट में जाओ अफ्रीका में, तो ये एक बहुत बड़ा फॉरेस्ट केन्या में, केन्या को भी जोड़ता है, युगांडा को भी जोड़ता है, रवांडा को भी जोड़ता है, नंबर ऑफ कंट्री को जोड़ता है। और एक कंट्री से दूसरी कंट्री में एनिमल्स का माइग्रेशन होता रहता है। ये एनिमल्स में किस टाइप के डिसीज है, एक जगह से दूसरी जगह पे गए तो डिसीज भी माइग्रेट हुआ एनिमल के साथ। ये एनिमल को देखने के लिए ह्यूमन गए, लोग गए, तो हम भी उसके टच में, उसके संपर्क में आए। हम प्रत्यक्ष नहीं आए तो पानी से गुजरे हैं, हमने वाटर को टच किया, लैंड को टच किया, हमने वहां के जो पेड़ है, पौधे है, उसको टच किया, तो उससे उसकी इफेक्ट सभी जगह पे कोई न कोई रूप में दिखाई देती है। एक सिंगल अप्रोच के साथ वर्ल्ड वाइड उसके पर एक डिटेल्ड डेटाबेस और स्टडी हो, ये बहुत आवश्यक है। इस टाइप के सेमिनार हमें इंटरनेशनल प्लेटफॉर्म प्रदान करता है। यहां मैंने देखा ऑल आर फॉरेन डेलीगेट्स, सब लोग यहां एक मंच से डिबेट करेंगे, डिस्कशन करेंगे। डिबेट डिस्कशन का आउटपुट हमें जो मिलेगा वो आने वाले दिनों में वन हेल्थ अप्रोच को आगे बढ़ाएगा। इस दृष्टि से मैं ये प्रस्तावना के साथ इस सेशन को ओपन करना चाहता हूँ। मैं चाहता हूँ कि उसमें बहुत सकारात्मक, हकारात्मक डिबेट डिस्कशन होगी, जो इंडिया के लिए और दुनिया के लिए उसमें से निकले हुए निष्कर्ष वो सभी को उपयोगी होगा। मैं यहाँ जो कोऑर्डिनेटर है उसको रिक्वेस्ट करूँगा कि उस सेशन के बाद और ये सारा सेमिनार खत्म होने के बाद वो डिटेल उसका रिपोर्ट तैयार करेंगे। उसमें वन हेल्थ अप्रोच के पर जो रिपोर्ट बने वो हमें भी शेयर करिए, हम भी उसका स्टडी करके और आगे कैसे कर सकते हैं उसके लिए हमारे लिए भी गाइडेंस मिलेंगे, मार्गदर्शन मिलेंगे। आप सब रुचि लेके इस सेशन में जुड़े हैं, आप सबको भी मैं बधाई देता हूँ। धन्यवाद।
Thank you to our Honorable Minister. A big round of applause once again for our Minister. We have a special guest with us, Dr. Bright, the Minister of State for Agriculture, Animal and Fishery from Uganda. So a big round of applause for Dr. Bright as well. Thank you, sir, for joining with us. Now, I would like to hand over the mic to our chair and proceed further.
Excellency Minister, how are you? Thank you, myself, Mansukh, Union Minister of Health, Chemicals and Fertilizers. Nice to meet you. Please go ahead. Please
Thank you, sir. Yes, sir. So I would like to call our chair and proceed with our session. Dr. Hirofumi, please. A big round of applause for Dr. Hirofumi for leading the session.
Okay, good afternoon, everyone. I'm very happy to chair this session. We have excellent introductory address by the Honorable Minister. So without further delay, I think we can start the session now. We have 5 speakers in this session. So first, I would like to invite my colleagues from FAO, Dr. Madhur and Dr. Son Junxia. So I don't know how, okay, Madhur will first. Okay, so please go ahead.
Thank you. Good afternoon, everybody. Honorable Minister, thank you so much for your kind remarks. My respected fellow panelists, ladies and gentlemen, namaskar, and thank you for giving me an opportunity to present about FAO's work on animal disease management and One Health. So I've already been introduced. I'm not going to take much without further ado. So FAO's strategic framework, here you see 2022-2031. This framework has been developed in the context of major global challenges in the areas of FAO's mandate, which is agri-food systems and the health of agri-food systems. So FAO's strategic framework revolves around the 4 betters, and here you see the 4 betters: better production, better nutrition, better environment, and a better life, leaving no one behind. And through this strategic framework, FAO enhances the progress towards the 2030 agenda for more efficient, inclusive, resilient, and sustainable agri-food systems. So, as part of the strategic framework of FAO, we have what are called as the priority program areas, and we have a priority program area on One Health. And this program area cuts across all of FAO's work. And the focus of this PPA is to support our member countries in improving food security by applying the One Health approach across the agri-food systems domain. And the livestock sector is part of that. So the One Health PPA really looks to have sustainable livestock transformation. So the goals of this PPA are achieved through improved pest and disease prevention, early warning, and management of national and global One Health risks, including antimicrobial resistance. So here you see are the 5 main intermediate outcome areas which contribute to One Health in agri-food systems. And these 5 pillars are improved early warning systems for One Health, and the Honorable Minister just spoke about, the importance of data, collecting the data, converting it into intelligence, into insights, into actions, multi-sectoral actions. So this is the area of work that focuses on that domain. Better biosecurity for pest and disease management through greater integration of biosecurity tools and progressive management pathways for managing disease risks. More efficient emergency preparedness and response, heightened AMR risk management, and enhanced One Health systems, including the environment. And how do we aim to achieve all these outcomes is through strengthened One Health system capacities. So this is the cross-cutting area which cuts across all the work that we do. And this includes One Health workforce capacities, investments and infrastructure into the livestock systems at all levels. Now I'll talk a bit about Empress Animal Health. So Empress Animal Health is FAO's flagship program for early warning and prevention of food chain crises caused by pests and infectious diseases. And this program is a cross-cutting program again. So there's an animal health component, there's a plant health component, and there's a food safety component. The animal health component includes aquaculture, the plant health component includes forestry, and then there's food safety. The role of Empress is to monitor and analyze and anticipate disease risks, provide technical assistance and advice to countries to build their capacities to prevent, detect, and respond to diseases, develop evidence-based policies and strategies for control, and to facilitate, coordinate, and communicate all actions with the national, international partners and stakeholders. So I'm going to talk a little bit about early warning now. So here you see the work that we do through early warning. One of the core areas of FAO's mandate is to collect data on agri-food systems, and disease data is a part of that data that we collect. And our main tool for collecting animal disease data is Empress I, or the Global Animal Disease Information System. I'm going to talk about this in another session. So through a daily disease monitoring and tracking process, we collect data from all over the world. And here you see this data is collected from across countries because FAO has offices in more than 190 countries all over the world. And we collect all this data, we analyze it, we use it to forecast risks. We provide alerts to our member countries on a regular basis. We provide situation updates on animal health threats that might come at regional, national, or global level. And we use this data to do risk assessments. So the most recent risk assessment that we did for this region was the lumpy skin disease risk assessment for the Asia-Pacific region, when lumpy skin disease was introduced into the Asian continent. The work that we do on better biosecurity or progressive biosecurity management is coordinated with our main partner in animal health, WOA, or the World Organization for Animal Health. And we do this under a cooperation framework, which is called as the Global Framework for the Progressive Control of Animal Diseases. So this framework was established between the then OIE and FAO in 2004. And it's a coordinating mechanism that brings together not only FAO and WOA, but member countries, the public and the private sector, academia, and the regional and the international organizations to support countries in reaching the goal of early detection and prevention of various animal diseases. And some of the diseases are mentioned here: foot and mouth disease, PPR, African swine fever, rinderpest, lumpy skin disease. So all these are diseases that are coordinated under the GFTADS framework. Now, the objective of GFTADS is really to look at member states' priorities. What are their priorities in addressing the progressive control of these diseases? Do they have the capacities to address these diseases? And then what are the necessary partnerships that they need to have in order to sustain the control of these diseases? So you see priorities, capacities, and partnerships, PCP. That's what we work together on. GFTADS has recently established a partnerships and financing panel, which gives advice to GFTADS on how sustainable control of these transboundary animal diseases can be achieved. And we have a member of that partnership, a member from India also, who is part of that partnerships and financing panel. These are some of the diseases that I already mentioned, so I'm not going to dwell too much on these. Now FAO is shifting its focus more and more to working at the last mile, to working at the producer level and along the value chain level. And we are developing a progressive management pathway for biosecurity. Now, this pathway is not a disease-specific pathway. It's a pathway for animal biosecurity, which seeks to achieve One Health and biosecurity along livestock value chains. It's a pathway that seeks to enhance animal biosecurity from producer to national level by building on existing frameworks, capacities, and tools based on the cost-effective management of risks through co-developed and co-owned consensus-based approaches at producer level and value chain level with shared public and private responsibilities. So here you see are the 4 stages of the pathway. The premise is that every country should be able to identify itself in one of these stages, and each stage should provide a tangible benefit to all the stakeholders. And through a public-private approach, you look at what might be the challenges to retain the commitment in this biosecurity pathway and how these challenges can be solved. So as livestock producers, countries advance along the PMPB, the benefits are expected in improved health and production, less infectious animal diseases, reduced antimicrobial use, decreased environmental impact, and eventually it results in improved health, production, socioeconomic benefits, and these eventually attract investments in the livestock sector and achieve the food, nutrition, security, livelihoods, and the One Health goals. So India has a lot of rich experience in this domain, and we hope to closely partner with India in working in these biosecurity pathways and learning the lessons from India and taking them to the other countries. One of the areas that has been spoken a lot about here has been animal health and climate change. Even though we talk a lot about it, there are a lot of gaps in our understanding. How does good animal health reduce emission intensity? How does it enhance resource efficiency, production, fertility? How does it facilitate trade and exchange? And there have been some studies done on certain diseases like mastitis, African trypanosomiasis, East Coast fever, foot and mouth disease, which give some evidence of the benefits. So the important role of animal health within this nexus needs to be further explored. FAO's work has been, in the past 15 years, focused a lot in developing and strengthening animal health system capacities. And FAO has a lot of tools to assess institutional capacities. And some of the examples of the tools, I will come to them shortly. And these tools, they assess capacities, and then based on those assessments, 360-degree roadmaps are developed for progressive improvement in capacities. Some of the examples of the tools are the laboratory assessment tool. So there's a whole suite of tools for assessing laboratory system capacities. It includes LMT core, LMT safety, LMT AMR for assessing antimicrobial resistance surveillance system capacities, and now the LMT biothreat module has been developed. The LMT tool has been used in more than 39 countries, and over 300 laboratories have been assessed, and progressive improvement plans have been developed. The FAO's surveillance evaluation tool conducts a comprehensive and standardized evaluation of national animal health surveillance systems, providing country-specific action plans for improvement. This tool has been used in 26 countries in Africa, Asia, and the Middle East. And the use of these tools helps countries to progress along the PVS standards and also along the IHR standards, which are important for One Health. FAO runs a lot of different capacity development programs targeted at different stakeholders. For example, the farmer field schools, these are, they work with farmers in different regions and train them in good husbandry practices, good biosecurity practices. Then we have capacity development programs targeted at the frontline workforce, so the last mile veterinarians who provide services to the farmers. An example of that is the In-Service Applied Epidemiology Training Program, or ISAVET. And ISAVET is currently being implemented in 16 countries in Africa. It's a 3-month course. There's also the intermediate level field epidemiology training program for veterinarians, which is a longer course. So depending on what the country needs are, different types of courses are provided. When COVID-19 happened, it became very difficult for FAO to deliver capacity development trainings to our member countries. So we had to come up with an innovative solution, and we established what is called as the virtual learning centers. So the virtual learning centers are learning hubs in 6 FAO regions or sub-regions, and they provide trainings to different categories of professionals. By using information and communication technology, we cascade courses to large audiences across geographically disparate regions, and we train them in an economical and environmentally friendly manner. Virtual networking also allows colleagues to easily share experiences with different people. We realized that the VLC modality of training is very good for women professionals. And we found that in the last 1 year, women have been consistently achieving more completion rates than men in all regions. Here are some examples of the VLC courses that were delivered recently. So when lumpy skin disease came to Asia, we delivered lumpy skin disease preparedness course because the region was completely new to this disease. You know, the veterinarians had never seen this disease. Recently, a field investigation training course for foot and mouth has been delivered to support Indonesia when FMD came to Indonesia. There are courses on One Health, so courses like training on AMR surveillance, courses on managing risks at the human-animal interface, and many other courses on agroecology, on climate mitigation. All those are being developed and delivered in different regions. How do we take our work to the country level? So I mentioned that FAO has a huge network, so we are present in 190 member countries, 130 member countries. FAO's largest One Health capacity development program is delivered through the Emergency Center for Transboundary Animal Diseases. And this is currently present in 37 countries across Africa and Asia, and it's being expanded to Latin America now very soon, and more countries. The program really seeks to enhance capacities of professionals to prevent, detect, and respond to endemic and emerging zoonotic and transboundary diseases. And there are some figures on how ECTAD has supported One Health operationalization by establishing One Health platforms, by training lots of laboratory and surveillance professionals, and supporting response to many kinds of animal health outbreaks. We have an emergency management center. It used to be called Crisis Management Center. And the Emergency Management Center is a platform to support countries in emergency management. Whenever there is an outbreak of a high-impact disease, the missions are fielded and they support countries in managing those outbreaks and making sure that they are contained and they don't spread. There are different tools that they use. So good emergency management practice is one training course that they help to use to prepare countries. They help in incident coordination, because when an emergency happens, especially a One Health emergency, you see everybody wants to support, and there are donors and partners throwing money at the countries, but somebody needs to coordinate all the actions. So they specialize in those kind of things. So here is an example of the EMC support that has been provided to countries since 2006, and it ranges from just animal diseases to transboundary diseases to zoonotic diseases to emerging diseases. So I'm going to stop here and give it to my colleague Junxia, who will speak about some of the work that we do with our quadripartite partners. Thank you.
Good afternoon, colleagues. Thanks for the organizer for the great opportunity. I would like to share some perspective of how to manage animal disease risk and zoonotic disease risk and quadripartite, namely the FAO, WOWA, WHO, and UNEP. FAO, WHO, and WOWA, we have been working together to address animal disease risks for decades. And COVID reiterated the importance of One Health. And this year, in March, a new MOU was signed between the four organizations. UNEP officially joining the tripartite. So now the tripartite changed to quadripartite. So in order to increase the political commitment and international support for One Health and operationalize One Health at all levels, at national level, regional level, and global level. So last year in 2021, FAO took the lead on the efforts to develop the One Health Joint Plan of Action, and through the quadripartite secretariat, with the colleagues joining from the other organizations. So this GPA is now being finalized and will be soon published. So it is developed to be country-oriented with a view to establish and achieve national targets and priorities for One Health intervention, and it will be also a framework with joint vision and commitment for collective and coordinated action to strengthen and mainstream One Health at all levels. With the implementation of this GPA, the whole of society approach will be promoted, and then we're hoping this enable the collaboration, learning and exchange across regions, sectors, and disciplinaries. So we hope it could play an important role to mobilize investment and make better use of resources across sectors and stakeholders. There are 6 action tracks you can see from the slides included in One Health GPA. As shown, it covers in all the span of One Health capacities. For example, the health system, emerging, re-emerging diseases, endemic diseases, food safety, and the environment health. So those 6 action tracks will drive the changes and achieve the longer-term impact. Sorry, yeah. So just now my colleagues Maduro already talked about early warning, prevention, preparedness. Those are really fitted in the action track 1 and 2. But now I would like to share something, endemic disease and AMR, that's are under action track 3 and action track 4. I'm really happy endemic disease was included in this One Health GPA. So in relation to dairy cattle sector, there are 2 zoonotic diseases that's really important. I believe all the veterinarians you are handling with dairy cattle, we are familiar with these 2 diseases. This is number 1, brucellosis. So we are working, FAO working with CDC on a stepwise approach and to really progressively control brucellosis. We try to, this could be a guideline and define the different stages. And from the slides you can see there are 5 stages, and based on the situation, disease situation, and we provide the guidance from one stage moving forward to the next stages. So the tool is now, we already have pilot. This tool has been developed like years ago. We already pilot in some countries covering Asia, Africa, and also some of countries in Middle Asia and Europe. Next week, there is a big event on brucellosis conference in Teramo. We will have a side events, and then during the events, we are going to get further reviewed and inputs from some Brucella experts. So to have a kind of final check before publication. So we are hoping we can get this done. We are hoping we can support the members, we can support the sectors. This tool is designed, it could be applied with countries, with region, and also with sectors specific context. So we are hoping we can help this brucellosis. It has been neglected for many years. So the second disease is bovine TB. This is another one, a zoonotic disease, very much relevant with the dairy sector. Zoonotic TB is also has been sleeping for neglected, TB is maybe on high agenda. The United Nations Sustainable Development Goal has set the target for achieving health goals. One of the targets, SDG 3, includes the target for ending global TB endemic by 2030. So in 2017, FAO, ORE, WOWA, and the WHO, in collaboration with the Union, published this zoonotic tuberculosis roadmap and called for coordinated action and through the broad engagement across political, financial, technical levels. And then, since then, we already have a working group among the three organizations and to try to coordinate the efforts with different stakeholders. But we are facing some limited resources, financial resources, human resources, but even though we know it is challenging to achieve really end endemic TB by 2030, but we all know that we need to continue this effort. Otherwise, we cannot achieve this goal. So welcome all join the efforts from endemic, from civil society and private sector, and we can do something together to end TB endemic. So this is another big issue at a human-animal environment interface. And we heard many experts already mentioned AMR, I'm really very happy in many sessions we heard initiatives at farms. So we know that overuse and misuse of antimicrobials is the main driver to the resistance. So currently, there are almost 73% of antimicrobials sold globally are being used in livestock. So how we can really make changes? So now FAO's collaboration with our quadripartite organizations, we are going to launch a global initiative, reduce the need for antimicrobials on farms initiative. This should be, it's supposed to be a longer term. We're thinking it's a 10-year initiative. We are looking for the reduction 30 to 50% of antimicrobial use on farm level. So the focus is really on farm level. You can see farm is on the core. And we are thinking to reduce the need. We are not talking about reduce the use, because if we really need, you can use it. But we have the solution to reduce the need. So for example, you can through the good husbandry practices, you can through behavior change, you can also through good vaccination program and alternatives to antimicrobials. So this is we are focusing on farm level, but the initiative, we are encouraging all the stakeholders, national, regional, and even global level, we can contribute to farms because they are farmers, they are really the users of the antimicrobials. So again, looking forward, today we have many, in this event, very glad to see some farmers, they are joining, and really looking forward to the efforts from really bottom up, from our farms, from farmers, and then associations, academia, everybody, you can have a role. You are the part of this solution. So we will have a side events in this evening, talk about the flagship FAO AMR program. So in that session, I will give more background on the whole picture, AMR in agri-food system. So this is the last slide of the presentation, just showing the One Health. This is the One Health figure of the One Health definition developed by OLAP, showing the connection between human, animal, plant, and the environment. I'll stop here. Thank you very much for your attention.
Thank you very much, Dr. Madhur and Dr. Junxia, two colleagues from FAO. They introduced FAO programs and activities highlighting on One Health related activities on AMR and zoonosis. Okay, so I would like to introduce next speaker, Dr. David Kelton. Yes. He chaired morning sessions, so I believe many of you already know him. So His speech is One Health and One World, so please go ahead.
Thank you very much, Mr. Chairman. Ladies and gentlemen, it's a pleasure to be here and share with you my perspective on One Health globally as a veterinarian, a research scientist, and try to give you a little bit of a perspective in about 15 minutes of what I see in terms of the successes we've had in the realm of One Health and a One Health approach to research, and also some of the challenges that we face. I do come to this through a veterinary lens. I'm a veterinary epidemiologist. I'm also very pleased to have a long track record working with the dairy industry. I currently hold a research chair funded by our dairy producers in Ontario, Canada, where I come from, and so I try to spend a good proportion of my time working on applied questions and resolving applied issues on dairy farms. But in taking a step back and thinking about a One Health approach, I'm also very proud to be a member of our One Health Institute at the University of Guelph, which we established about 4 years ago. Now, as you can imagine, just about every university now has a One Health Institute, every organization. One Health has become very much a buzzword, so did we need another One Health Institute? Externally, probably not, but internally, when you think about the traditional structure of universities around the world, we're based on colleges and departments within colleges with a very narrow discipline. And this gave us a virtual platform to break down some of those traditional silos and get scientists from across the breadth of the One Health envelope working together. And early returns, I think we've been somewhat successful in doing that. Anybody who's looked will find many, many definitions of One Health and a One Health approach to tackling complex issues. This is one, I particularly like this one from the CDC in the US, but there are many others. Invariably, where these definitions start is in that interface between people, animals, and their environment. And some people now are putting a fourth circle in there, taking plants out of that environment circle. But these overlapping rings, and that is sort of the area that we work in. When I look at this definition, though, the words that jump out at me and that they're really at the core are collaborative, multisectoral, and transdisciplinary. To bring together expertise in groups, as my colleagues already have talked about, to tackle some of the complex issues that we face today. This isn't easy, it isn't simple, it isn't something that we've traditionally done, and so we actually have to work at that. Another definition of One Health and a One Health approach, again from the quadripartite group that was already mentioned previously. So again, I won't spend a lot of time in terms of the definition. You've seen this graphic in the previous presentation. But the elements that jump out at me here are sustainably balance and optimize the health and sustainability of people, animals, and the ecosystems, and try to do that in a fair and balanced way. When we tackle complex issues, even with a One Health approach, we run the danger of all the benefits accruing in one of those areas, and traditionally it's been public health, human health, sometimes at the sacrifice of the others, even though we're taking a One Health approach. I think over the last couple of years, I think globally, our experiences with the COVID-19 pandemic, I think, has taught us a lot. Within our own One Health Institute, the University of Guelph, it gave us an opportunity to address some issues not only in the public health spectrum, but also in areas related to wildlife, companion animals, and what was their role in transmission? Were they at risk? Did they need to be vaccinated? And in terms of the environment, wastewater particularly. And we looked at developing techniques of actually monitoring and identifying outbreaks through identifying COVID-19 and wastewater from buildings and other facilities. So again, a multidisciplinary, a cross-sector approach to tackling some of the problems that we see. This notion of overlapping circles and the realization that problems are complex isn't necessarily new. While the use of the term One Health really goes back only 10 years or not much before that, those of us working in epidemiology might recognize this overlapping circles of the animal, the agent, and the environment. And a lot of this comes from the early work done by people like Cal Schwabe at the University of Davis, or Wayne Martin, who's my mentor at the University of Guelph. That recognition that when disease happens, whether in people or animals, there are multiple areas in play, and that we need to think about all of these if we're going to understand the etiology and also try to control diseases. And this notion of the importance of the environment, which is central, I think, to our One Health approach, isn't necessarily new, but it's nice to see that we're formalizing that across a broader spectrum. I want to share with you very briefly sort of my first introduction to a One Health, or one of my earlier introductions to a One Health approach, well beyond the term One Health came in vogue. As I mentioned, I work for the dairy industry and work with milk producers and understand, I think all of us in the room, that milk is a very complex, nutritious food. And we think primarily about things like fat and protein, but there are other elements like iodine, where milk serves as an excellent source of dietary iodine. Now again, from a dietary perspective and a health perspective, we don't want too high levels of iodine necessarily in any of the things that we consume. And so in Canada, our public health agency routinely monitors iodine levels in a number of foods, including dairy. And about 12 years ago, they found that in some regions of Canada, there was some dairy that was creeping up towards the allowable limit. Still not over the limit, but moving upwards. And so they asked a number of us to form a group to investigate this, to understand why in some regions of the country we're seeing this creep. We did a typical study. We went out to farms. We looked at how cows were fed and treated. And at the end of the day, our initial study concluded that the iodine in these higher level iodine herds was coming either through the feed, based on what the cows were being fed and supplemented in terms of iodine, or the way that iodine-based T-dips were being used, either applied too aggressively as a pre-dip and not removed prior to milking, or in the post-milking scenario where there was a lot of spread of the iodine over the gland and not just the teats, which allowed absorption through the skin. What puzzled us, though, is when we looked at our data, understanding those risk factors only explained about 35 or 40% of the variability, so there was something else going on that we were missing. About that time, we were fortunate to have a discussion with some colleagues in the area of geology, and they pointed out that a study had recently been completed, and this is a map of southwestern Ontario, where most of our dairy farms are located in Ontario, in the central part of our country, where they had tested well water from a broad number of wells across the province and tested them for heavy metals, for minerals, for contaminants, and all sorts of things. One of the things they looked at was iodide in that water. And when we mapped our high iodine herds to the high iodide well water areas, there was an incredible overlap. Long story short, we worked with geologists, hydrogeologists, chemists, and found that in fact we could trace the high levels of iodide in the water through the cows, actually into the milk, through fingerprinting of those elements. The geographers looked at us and said, well, that shouldn't surprise you. This part, the central part of Ontario around our Great Lakes, was once an inland sea. Seaweed is very high in iodine. There are deep deposits of old seaweed that was once the inland sea bed, and that when we drill wells looking for water into those areas, we get high iodide in the water. But when we went back and in those, again, repeated our study and now also looked at water samples, we were actually now able to explain over 70% of our variation, and so identified an important factor by working in a multidisciplinary approach and expanding our team and bringing some other expertise in. So essentially a One Health approach. As I wanted to prepare for this presentation today, I've got a PhD student working with me, Sydney Pierce, in the One Health area, and one of the things that she did as part of her dissertation was did a bit of a scoping review. And the reason for the scoping review is to understand, well, the One Health approach, nice to talk about, I think we all embrace it, but what kind of an impact has that One Health approach really had? Can we show some tangible benefits? She did a scoping review. This goes back to 2010 when the first published studies that explicitly say they use a One Health approach were published. And you can see that most of the published literature that shows results of One Health work was really done just in the last couple of years. So it's a fairly new area of endeavor. But as she broke apart that work that has been published, some encouraging things came out. For instance, not only do we see the One Health approach applied in North America and Europe, but we also see it well applied in Africa and throughout Asia in a number of different aspects. So we see it being used equally in developed and developing nations, which I think is highly encouraging. When we look at the disciplines, and again, when we think about animal health or human health, we've got sort of our traditional group at the bottom, our animal scientists, our human physicians and health experts and so on. But again, as we look at the list of authors and contributors to these studies, we're seeing that broaden, so that multidisciplinary approach is actually happening, which is very encouraging. We wondered whether there was any demonstration of some successes. In other words, can we demonstrate the value of a One Health approach? The only publication we could find to that end was one it's about 5 years old now, that actually looked at some of the outcomes from some of these One Health approach studies, and again, very encouraging. Even then, they were able to point to some very discrete examples where One Health approach had yielded some benefits that could be quantified and that accrued primarily to the public health sector, but in other sectors as well, animal health and the environment. So we're moving in that direction. There's some really nice case studies and individual stories that I don't have time to share with you, but I think as we start to look at these and we start to look at the cross-disciplinary work as is illustrated when we look at the list of authors in some of this work, I think we are seeing that multidisciplinary effort, and I think that's very encouraging and positive. And again, across the spectrum of human health, animal health, environmental health, there are some really nice examples of where certain discrete problems have been addressed using this approach, and we've seen some tangible and positive results. One of the things that surprised us, maybe it shouldn't have, is that a couple of areas where we haven't seen those documented outcomes, positive outcomes from the One Health approach, are in a couple of the big areas that we hope this will be successful in: antimicrobial resistance and battling climate change. Now, we recognize that to see positive outcomes will take a longer period of time, and there are some smaller successes that are documented in the literature, but I'd really like to see more of that come forward as we try to use that One Health approach to address some of these much more complicated, larger, and global issues. I'll wrap up this presentation with some challenges that I think that we face. I think all of us, whether we're working in human health, environmental health, or animal health, when we're faced with emergencies, it's very easy for us to fall back into our traditional paradigm and focus on the area that we're most comfortable in, the area that's affected, and not necessarily maintain that balance. And what I mean is that sometimes what we implement to address an issue in animal health perhaps may have some downstream detrimental impacts on the environment. So again, we need to take that step back and recognize that our response, even if it has to be dramatic and rapid, we need to understand those broader implications of the responses that we take. Secondly, I mentioned the reason for establishing our One Health Institute at the University of Guelph. But I think globally, certainly in Canada, there are a lot of elements of the arena we work in that are very siloed. Our government organizations, we've got ministries of health, of agriculture, of the environment, that are again, sometimes tend to be siloed and competing for resources. I already talked about the issue in academia where again, our traditional structure is very siloed by discipline. Even our industries are set up that way, and certainly our funding bodies. Certainly in Canada, some of our largest sources of funding are set up for either human health or engineering or environment. There are relatively few pots of money that actually encourage that cross-collaborative work. Those are growing, but they're still limited. And finally, I think if we're going to be serious and we're going to talk about a One Health approach, I think we've got to be very careful that we document those successes that we've had. So not only talk about implementation and try to build capacity in multidisciplinary teams, but I think we've got to be forthcoming and demonstrate the impact that that approach has had so that then we can build that cascade and convince others of the importance of funding this type of work and building this kind of infrastructure so that the One Health approach isn't just a fad that disappears again from our lexicon in the next decade, but that it continues to grow and gather steam. Thank you very much.
Thank you very much, Dr. Professor David.